So we have, as I just alluded to, a group of patients who are pain prone. These are patients who, if I can use the term loosely, have a volume control setting located in that area which I showed on the previous slide, which controls the amount of pain that they will feel. In other words, they will have a setting in their central nervous system that allows too much pain to go through in some patients and some pain to be reduced in others, just like my football player compared to my office manager. So how does this happen? This is likely a predetermined, genetically predisposition that will have these patients fall into a category of these are the people who have diffuse hyperalgesia or allodynia. Allodynia is pain to a non-painful stimulus. That's the cold shower and the sunburn. And the hyperalgesia is the friend who slaps you in the back on top of that sunburn, and it should hurt a little bit, but you jump out of your Speedo, because the fact is that that mildly painful stimulus is perceived way out of proportion than what it really was. So these patients who have this pain sensitivity or this high volume control setting, which takes any normal signal and makes it feel more painful than it should be, these folks are referred to as pronociceptive. Now, the pronociceptive group has been studied, and the study has been done by a dentist, actually, in the University of North Carolina and 3 other centers. Bill Maxner led this study. 35,000 patients, more or less, are involved in this study. And it's been determined that 3 to 5% of the general population is pronociceptive, which means that this is a group of patients who have chronic pain disorders in general. Fibromyalgia, irritable bowel syndrome, temporomandibular disorders, migraine headache, and so on, low back pain. All of these patients fall into this pronociceptive group. And the data is irrefutable that these pronociceptive individuals are predisposed towards increased response to stimuli that are non-noxious but perceived as painful, allodynia and hyperalgesia. Now, this, for you people who are doing implants on a regular basis, is important information, because this important information helps you to screen these patients. Think about a history that could include, do you have any of the following, and of the listing of the things that I've just mentioned, fibromyalgia and so on, chronic low back pain, migraine headache, temporomandibular disorders. Have you ever had a previous neuropathic pain or chronic pain disorder? Are you taking medications for anything? These are risk factors that would say, well, maybe we don't want to get married to this patient for the rest of our natural lives, and the patient will probably kill me first anyway, because of the chronic problems that they're going to be coming back to me with.